In this next video, we'll talk about a few issues of reproductive health. Two issues of human reproductive health are contraception and transmission of disease. Now, contraception is the deliberate prevention of pregnancy. There are many forms of contraception, each with varying degrees of reliability. Some forms of contraception are quite effective, others less so. So in this chart, we see contraceptive methods and their effectiveness. Or another way of thinking about this are the failure rates of contraceptive methods. Now, these failure rates are listed as pregnancies per 100 couples having regular intercourse throughout the year using this particular method of contraceptive. I also want you to notice that in this chart, there's the effectiveness when that contraceptive method is used correctly, and then the effectiveness when that contraceptive method is used typically. This could mean improper application of the contraceptive, missing a pill here or there if we're talking about hormonal or pharmaceutical contraceptives, or a variety of other small things that might inhibit the effectiveness of that contraceptive method. Proper education on what the methods are, how to properly use them, does increase the success of the contraceptive methods. But do keep in mind, looking at this chart, each type of contraceptive method does have a failure rate. So there are couples who get pregnant using these contraceptive methods. The next concept of reproductive health is that of sexually transmitted diseases or infections. STDs or STIs. They are infectious diseases spread by sexual contact. Now, sex isn't the only way in which these pathogens might be spread, but they definitely can be transmitted sexually. Viral STDs, such as AIDS, genital herpes, and genital warts, they cannot be cured with our modern medical techniques, but certain medications can control the symptoms to some degree and may be able to help somewhat prevent the further transmission of these. But typically, once an individual has acquired these viral STDs, they will have that STD for the remainder of their life. STDs caused by bacteria, protozoans, and fungi are generally curable with drugs or pharmaceuticals. But for some of these, it often requires the application of that pharmaceutical early in the infection process, especially if the goal is to avoid permanent consequences. So some of the most common STDs in the United States include chlamydia, gonorrhea, and syphilis, as far as bacterial STDs are concerned. And these are treatable with antibiotics. But again, something like syphilis requires treatment early in that infection process. Viral STDs, such as genital herpes, genital warts, and AIDS, they are not curable once they've been acquired. Although, for certain types of viral STDs, there is a vaccine which might help reduce the likelihood of becoming infected in the first place. There are also some protozoan and fungal STDs as well. One of the most important pieces of take-home information here is that if you are concerned that you may have an STD, it's important to get it looked at, identified, and treated as soon as possible. In the next video, we're going to talk about the stages of human development, starting immediately after fertilization. See you in the next video.